name is Dan McKee. I'm the CEO of Grace Inspired Ministries. It's Friday, May 8th, and I wanted to give you an update on our response to the COVID-19 pandemic and also answer some of the frequently submitted questions we've had here at Grace Inspired Ministries. So as far as our cases on campus, we have no residents who have tested positive on the Telford campus. We've had 5 residents in our skilled nursing facility at the community of Rockhill who have tested positive. Unfortunately, 2 of those residents have passed away due to COVID-related illness. We pass along our condolences to those families, and we ask that you please pray for those families and all of our families and residents who have been affected by the COVID-19 illness. As far as testing and those cases on campus, you can access the results of our test on our website just by clicking the COVID banner and then clicking the tab for campus testing. I'd like to also speak to our employees at both campuses. First, I want to say thank you. Your talent, your generosity, and your dedication really have been overwhelming. I've received so many thanks from residents and families, and I want to make sure you're aware of that and know that you are appreciated in the efforts you're making. I will ask you also to continue to be vigilant. We've said in prior memos that just come to work, go home, and continue to do social distancing. We appreciate what you've done to keep our communities free of COVID. I will also ask you to continue to monitor for symptoms, and when and if you do have symptoms, please contact your primary physician. Let us know here at the communities, and we can also assist in getting you testing if that's needed. We will also continue to keep you updated on what's happening on campuses and any changes we're making through the memos we've given to you and posted at the time clocks and through the information we're providing on our website. I'll talk a little bit about testing and our testing philosophy on both campuses. We've seen a little bit of a difference between what's happening at Montgomery County and Bucks County, and we sit right on the border. Our communities are both in Bucks County. But Montgomery County had called for testing of all residents and staff members a week or so ago, although I think there may be some change in that. What we've heard from Bucks County, and in particular the Bucks County Department of Health, is that they do not want to see widespread testing on our campuses. So that's kind of informed our approach with testing. What we've done is we've set up a dashboard for symptom monitoring in healthcare. We do monitor symptoms on each shift, so 3 times a day we're taking vitals and monitoring for symptoms of COVID. We have a dashboard that's shared with our staff members, our director of nursing, and our medical directors. We have a very low threshold for testing, so if we see a symptom, we readily test. And we've also expanded into what I'll call sample or batch testing. So at Telford recently, on Monday of this week, we did testing on the 3rd floor. We tested all of our residents. I think we had 19 staff members who volunteered for testing. And those tests, all of our resident tests did come back negative. We're going to be doing some testing on the 2nd and 4th floor as well, both today and Monday. And at the community at Rockhill, we've done the sample testing, and the last couple of batches we've done in skilled nursing have come back negative. So the reason we're doing that is we want to continue to look for asymptomatic residents or staff members who may have COVID, and we think this is the best way to move forward with that. The other areas of testing that we're looking at are antibody testing and rapid test. First of all, we're at least 3 or 4 weeks out from having those readily available. That's basically been the feedback from our local hospital and the labs we've been dealing with. There would be some benefit to that. So the antibody testing, the benefit of that would be if we have an employee who has antibodies and maybe already had the COVID, they would be ideal to work with our COVID positive residents. So that's a reason for doing that. The rapid tests, from what we're seeing for some of the health systems that are doing that now, is they have the ability to have the results in 15 minutes, which I think would be beneficial as well. The most common question we get is, well, why wouldn't you test everyone on campus, all of your residents and all of your employees? First, logistically, that would take a few days to do. We have both campuses combined, we have over 1,300 residents and staff members. And we're generally getting our test results in 48 hours, so by the time we tested everyone and got all of those results back, we'd be several days past the time when the testing was done. So during that time, more people could have developed COVID, and we don't know how effective that would be to have that done. And then will we be able to do that on a continual basis? Probably not. Other questions we've received have been about the restrictions we have on campus. First question is, when will we be lifting those or easing those restrictions? What I can tell you is, although we're monitoring what the state's doing with that, and just yesterday they came out and said for Bucks County, they will continue the restrictions through June 4th, I believe. But what we will be doing on our campuses will definitely be lagging behind what the state's doing as far as lifting restrictions. The main reason for that is, A, we deal with the most vulnerable population with who we have on our campuses, and B, we have congregate settings in our residential setting, and in our healthcare setting, we have pretty close proximity of residents, and we also have high contact care we're providing. So as far as lifting restrictions, they're the main reasons we wouldn't be lifting those right away. But we will keep you posted on when we think we can change any of the services we're providing or add more services. The other question we've had is why the complete lockdown on the campus. So I think it was just prior to Easter we had set up the guard shacks on both campuses and are really closely monitoring who's coming on and leaving the campus. And the reason is, while we had asked not to have visitors in our residential buildings and all of our buildings on campus, that was continuing to happen. We were concerned with the surge that was happening in our community and continuing to happen in our community, that we really needed to get a handle on that and lock down the campus. So that was the reason for the full lockdown. So what we're doing at this point is we are working on some protocols for when services could come back. Again, we don't have a timetable for that, but a good example is for housekeeping for our residential folks. So on the Telford campus, we had discontinued housekeeping about a month ago. We're using those housekeepers to do more cleaning in the common areas of the residential buildings and also in our healthcare buildings. But I've had feedback from family members who've said, well, maybe my mom or dad can't really safely clean their apartment on their own. It's been a month now. What are the plans? So we've asked our director of housekeeping to come up with a protocol on how we would clean campuses in those types of, clean apartments in those types of situations. So those protocols would include things like, would the resident remain in the apartment? If they're not going to remain in the apartment, where would they go while the apartment is being cleaned? How long would it take to clean? Things of that nature. So that's one that, we need to get in place probably within the next couple of weeks so that we can do some limited cleaning in the apartments. But we'll be looking at other areas. So for instance, dining services. When we can open up a dining room, how will that work? Will we have people sitting 6, 8 feet apart? What type of personal protective equipment would the wait staff be wearing? Would we be using all paper products and disposable menus? It makes sense for us to work on those protocols now, even though we don't have a time frame for when those services come back in place. So we're actively working on those things. Just a couple of reminders in closing. One is, and this is for our residents and staff members, please continue to do the hand hygiene, social distancing, the mask wearing that we're asking you to do. That will help keep yourself and others safe. As far as drop-offs, so a lot of families are dropping off food and supplies for residents. I'll ask that you try to do that between the hours of 9 and 4. That's the best time for us to be able to get that quickly out to the apartment. I'll also ask that you label those supplies with the resident's name, the apartment number, and the building name. So we do have, for instance, several apartment number 110s. So having the building name will help us get that there quickly. And then I'll also ask, when you drop that off, if you do have perishables, please let the receptionist know. Now, the table where you're dropping that off is outside of the reception area. Just walk in for a second and let the receptionist know that you have perishables there. And we'll make sure we get those things to the residents right away. So far, we haven't had any melted ice cream, and we want to keep that up. So finally, I'll say, please call Robin Bickle, Director of Resident Services, if you have a special need for an item or a need to leave campus. Robin said she's approaching that very much situationally, so she will do her best to accommodate what you need, so please let her know. And then finally, I want to thank the residents and their families for their patience during this trying time. We appreciate your support, and we thank you for all you're doing to help keep our campuses safe. Thank you, and have a good day.